Introducing you to the big boss in the diabetes management, the HBA1C levels, and how metabolic surgery can reset the high HBA1C levels in type 2 diabetics. HBA1C and diabetes are synonymous. If you are a diabetic or have a family history of diabetes, or if you are obese, then you've got to know about it. What is HBA1C and how is it formed? HBA1C can be called a sugar-coated protein. Now, the sugar from the food that we eat enters into the blood, and this combines with the protein called hemoglobin in the red blood cell. When excess glucose in the blood binds to the hemoglobin protein in the red blood cell of the blood, then a molecule is formed which is called as glycosylated or glycated hemoglobin. Higher the levels of glucose in the blood, more amount of glucose will bind to the hemoglobin in the red blood cell, and higher will be the levels of your HbA1c. This sugar-coated protein damages the cell wall and it thickens the blood. It causes plaques, narrows the vessels of the heart, the brain, the kidneys and eyes. Unlike the fasting blood sugar test and the postprandial blood sugar test, HbA1c gives us an average of how your body has been managing blood sugar levels over the last 3 months. The life of the red blood cell, which has that hemoglobin, is around 90 days. Non-diabetic, pre-diabetic or diabetic? If your HbA1c levels are less than 5.7, then you are not a diabetic. If the levels are between 5.7 to 6.5, then you are considered to be a pre-diabetic. If they are more than 6.5, then you are a diabetic. Now it's time to gear up, get your HbA1c done and repeat it once in 3 months. This gives your doctor an opportunity to manage your sugars well. If you keep your HbA1c levels under control, you can avoid complications related to diabetes that affect your heart, your eyes, your kidneys, your feet and so on. If regular anti-diabetic medicines as well as insulin are not able to bring your sugars under control and not able to lower your HbA1c levels, then metabolic surgery could be a very good option. Metabolic surgery is a keyhole laparoscopic surgery done on the stomach and the small intestine in type 2 diabetics in order to reverse diabetes. Metabolic surgery sets an auto system of hormonal interplay in the body, due to which anti-diabetic medications and or insulin may not be required to maintain normal blood sugar levels in a diabetic patient.